Patients who get chemotherapy, especially IV cisplatin-based chemotherapy and also many other chemotherapies, are constantly dealing with dehydration due to wastage of fluids and electrolytes through the kidney and nausea, vomiting leading to poor oral intake. And because of this, they end up being dehydrated and have low potassium, low magnesium, and we are constantly trying to check their labs and send them to the infusion center to get IV hydration and IV potassium and IV magnesium through their ports, and this leads to additional challenges. The chair time is probably used more efficiently for actual delivery of chemotherapy rather than constantly giving them IV fluids and IV potassium and IV magnesium. And also in these days with COVID, we are trying to avoid unnecessary exposure of patients to situations where they are interacting with too many people and potentially at risk of catching COVID. So both patients and we as oncologists are constantly looking for alternate oral options to hydrate our chemotherapy patients and also to replace their magnesium and potassium orally. So I think we are very excited that there is this new product that is developed by a physician team which allows for oral rehydration, and also this solution called Humolyte contains human milk oligosaccharide called 2FL and also potassium and magnesium, which can be used to prevent gut injury so that there is loss. The losses that we have through the gut of fluids and electrolytes is reduced or prevented. So again, prevention is better than cure. So by taking this Humolyte, you are hydrating the patients well, they're getting their potassium and magnesium, the prebiotic is preventing gut injury, and we can definitely reduce or minimize the need for IV fluids or IV potassium and magnesium replacement, accessing port in neutropenic patients, which itself can be a risk factor of infection. And so I think this is an exciting addition to our armamentarium in the supportive care for our cancer patients on chemotherapy.